Hello, this is Dr. Mark Hamilton, a facial plastic surgeon here in Indianapolis. And today I'm answering a question that I get quite often, is which injectable filler is right for me? And this question has become even a little bit more difficult with all the new fillers out. We've had Volbella out now for about 6 months, and Velour is another one that Allergan is making that is just being released, also refined and defined from Galderma. So a lot of new choices. And for patients that can be a little bit confusing. On the flip side though, here in the US we still probably have less than 20-25 fillers available. If you were to go to England today, you'd have over 250 available. So even with that, all the fillers available, we still have just a few choices compared to some other places. So taking a step back, I think when you look at all those fillers, I do think there is one thing that stands out that patients should be aware of. And that is that the hyaluronic acid fillers have a distinct advantage over some of the other fillers. And that's why they're my favorite. One of those is that they're completely reversible. So if you have an area that doesn't look quite right, or if there's a problem with the filler, it's very easy for us to inject a reversal agent here in the office and take that away. And I think that's a big advantage compared to some of those other fillers. The other thing is that they're very well tolerated. It is extremely rare to have a reaction or some sort of issue with a hyaluronic acid filler, and we probably inject 500 of these a year, and just haven't seen a real reaction in years. So very, very well tolerated, and also long lasting. They'll last up to a year, and for some of them up to 2 years. So of all the fillers out there, that narrows it a little bit. Even within that hyaluronic acid filler area, there still are several brands, and I think they each have their distinct advantages and disadvantages, and this is where you really have to rely on your injector a little bit, and where there's a little bit of artistic sense here that's important. Certain fillers are very good for giving volume to the face, lifting the face, such as Juvederm Voluma. Others are better at filling in, such as Juvederm Volbella. Some swell more than others, which can be good in some locations. Some don't swell at all, such as Volbella, when we use it off-label in the eye area, is an excellent choice in that area. So I think relying on your physician, and when you go in, know the areas that you're most concerned about, and your injector will be able to help you pick the right filler for that area. That's the hyaluronic acid fillers, which I think are a great choice. There is one filler which I think has a distinct, unique feature that may be better for some patients, and that's Bellafill. Bellafill's a more long-term filler. It lasts at least 5 years, probably longer, in many patients. And for some patients, that can be a great choice. Now, there are disadvantages with that. It's not reversible, and you can develop issues in a small percentage of people with that filler. So I think you still have to be careful with it. But for those patients who have done a temporary filler, like the effect, and it's an area that we can use a long-term filler, Bellafill can be a great choice. So this has been Dr. Mark Hamilton talking about how to pick the right filler for you.